So, welcome to the Just for the Health of It podcast, interviews with local health experts, hosted by Warren County Public Health. I'm your host, Drew Crawford, a public health educator here at Warren County Public Health. And today we're excited to talk with Amy Wahl, the Direct Diabetes and Nutrition Services Program Leader with Hudson Headwaters. Am I correct? Did I get it?
Yes.
Yes.
All right.
It was a mouthful, but we got through it. And luckily enough, being a diabetes and nutrition services program leader, you're more than well equipped to have our conversation today with diabetes education. November is Diabetes Awareness Month. It's something that we have in the county here, quite an awful lot. But before we jump into that, I'll give you a chance to introduce yourself and let us know any fun facts about you, your credentials, how long you've been in the role, and if you could introduce yourself, that would be great.
Yeah, absolutely. I'm really excited to be here today. So I run the Diabetes and Nutrition Services for Hudson Headwaters, and I am a dietitian and certified diabetes educator. They changed the credential to be Certified Diabetes Care and Education Specialist, just to make it harder on you, Drew, to say all the words today. So they changed that credential recently. And I've been at Hudson Headwaters since 2019. I started in our food pharmacy program, which I'll talk about a little bit later as a dietitian. And then I've been in my current role running the Diabetes and Nutrition Services for about 2.5 years now. And before that, I've worked at many jobs as a dietitian. I worked at Samaritan Hospital as an acute inpatient dietitian. I've worked at nursing homes, and I also worked at Hannaford Supermarkets as a retail dietitian for about 5 years as well. So I've definitely dipped my toes in a lot of different things. But I've always kind of come back to that clinical sort of dietitian. And I guess something interesting about me is I used to be a ballet dancer. That was actually my first degree in college, was a BFA in ballet performance. And that field always had me interested in, eating healthy for performance and more like sports nutrition type of stuff. But I always was interested in pursuing more of a nutrition career, and that kind of led me into going back to school for nutrition as well. And I also was a licensed massage therapist, so it's kind of like that whole body holistic approach has kind of given a good foundation for me now, I guess you could say.
Yeah, absolutely. And you've done an awful lot more than I have, if I'm being honest here. But
well, I'm probably a lot older than you.
Oh man, but as we said, nutrition is super important. I myself, I've been playing soccer my whole life, and just recently did I stop, and it was really hard for me to. When I got out of soccer, it was really hard for me mentally to kind of get out of that nutrition piece where okay, you don't need that much protein anymore, or you don't need to eat that much pasta the day before anymore. It's really hard habit to break when you've been doing it your whole life. But while we're on the topic of nutrition, diabetes shortly follows right after nutrition. And diabetes in our area has become much more prevalent. But that kind of follows the same trend across nationwide that we're seeing through the research articles that we get, through the research papers and the numbers that we get. We saw an excess 33% mortality rate during the pandemic for diabetes. And diabetes, it can be a very complicated disease. It can also be a very simple disease if you have somebody like Amy explaining it to you. So, what are you guys seeing in Hudson Headwaters? What are you guys seeing about diabetes? Are you guys seeing an uptick, or are you guys seeing a trend in which it's moving? You're seeing it more prevalently, or are we seeing something completely different? What do you guys see?
Yeah, I mean, definitely the prevalence is there at Hudson Headwaters. So roughly our prevalence is about 14%, which is a little higher than the national average, is like around 11%. I mean, that's kind of combining type 1, but we don't really have that many type 1. The majority of our patients, like over 90%, are type 2. So, you know, we are definitely seeing that prevalence at Hudson Headwaters. And just with the patients that I see in the office, a good portion of the patients have diabetes that are referred for nutrition and, of course, diabetes counseling. But I do see patients that don't have diabetes as well. But in general, there's a lot of patients, and it seems like I don't have the actual numbers of how much it's increased in the past couple of years, but I definitely think, you know, especially with COVID and people staying home more, maybe not being as social, going out and doing things, not coming in for their doctor's visits as often, or their checkups or their lab work, we're now seeing kind of like this diabetes sort of increase in a way, you know?
Yeah, absolutely. And, you know, diabetes, as we said, you know, you kind of delved into it a little bit with type 1 and type 2. And, you know, for somebody like me, I never really learned about diabetes when I was in school. You know, we kind of brush up onto it, but I never really learned what exactly diabetes was, let alone the difference between type 1 and type 2. And if you wouldn't mind kind of explaining what diabetes is and really the difference between type 1 and type 2.
Yeah, absolutely. So type 1 diabetes is characterized by basically being insulin deficient. So it's your pancreas does not, that beta cell function does not produce insulin. So that's a disease where right off the bat, you need to have insulin in order to live and survive. And type 1 diabetes, a lot of times can be, it's definitely more genetic than type 2. And a lot of times there can be like an autoimmune, you know, it's considered more of an autoimmune disease than type 2 diabetes. And type 1 diabetes often presents differently. A lot of times type 1 used to be diagnosed more in childhood. But now we're seeing that there's definitely teens, and there even are adults that can be diagnosed with type 1 diabetes. And usually it's a blood work test that kind of differentiates that based on whatever the provider decides, you know, by meeting the patient. And then with type 2 diabetes, it's more of an insulin resistant type of disease, meaning that the pancreas still produces insulin. However, the body's cells do not allow the insulin to come in out of the, or sorry, don't allow doesn't allow the glucose to come into the cell. And that insulin is kind of like the key that unlocks the cell to let the sugar into the body to use it. So oftentimes we say type 2 diabetes is insulin resistance. And the cause of insulin resistance a lot of times is obesity. So that's where obesity rates, you know, come into play too with type 2 diabetes.
And it's very important that you bring up diabetes, because it is something that we are seeing a lot of in Warren County. 25.2% of all adults in Warren County, those 18 and older, are obese. That's 1 in 4. And, you know, it's not even just our adults, it also goes into our children and into our students. 17.5% of all of our elementary students are obese. 18.5% of middle and high school students are also obese. So we're seeing quite an awful lot of obesity. And as we said, that can play into type 2 diabetes. So what did you see, you know, with it upticking in that sense? What did you see as kind of like contributing factors or impacting factors or causing factors of, you know, this increase in this rise in diabetes?
Yeah, I mean, there's multiple factors. Obviously, obesity plays a part in that factor. You know, there can be a genetic factor, you know, because some people that are obese will never get diabetes. So it just has to do maybe with their pancreas and their beta cell function too. But with obesity, there's a lot of things involved with that, as far as, we're more sedentary now. We're not getting the exercise or getting our steps in, the healthy eating aspect. So making sure you're not eating as much sugar and, eating your vegetables and all that, definitely plays a part in that. We have more screen time now. Kids are, on the screen more, on their phone instead of going outside and playing maybe. Same thing with adults. We're on our phone more instead of going outside and doing something. So it's type 2 diabetes, especially, is a lifestyle, can be a lifestyle disease, as far as there's a lot of lifestyle factors that you can change that could improve either not getting diabetes or maybe reduce your complications down the road with diabetes.
Absolutely. And, it's important that you bring up going outside, because I had just finished up a indoor air quality podcast, and it was revealed to me that Americans spend right around 90% of their time indoors. And with that, it's pretty startling. That definitely wasn't so much the case further back. A lot more people were going outside, a lot more people were spending a lot more time outside. And with that, there was just natural exercise going around and running around and all of these things. And for diabetes, that can be really positive. Making sure that you're exercising, like you said, making sure that you're eating your fruits, eating your vegetables, even broccoli, you still got to eat it. And what do you find when you're talking to patients that may have diabetes, or talking to the community? What do you find are the biggest barriers when talking to people about diabetes to, I guess, what are the biggest barriers to letting them recognize that this could be something really big and we're trying to make it not such a big thing anymore?
Yeah, I mean, first of all, there's so many barriers. I don't think we have enough time to talk about all the barriers. But having that initial conversation with patients, you don't want to scare them, but you want to make them aware that this is something that we can work on, and it will make a difference. I think sometimes people think it doesn't matter what I do, nothing's going to change. But having that positive outlook that you can make these changes. But as far as barriers go, there's, the social determinants of health. I'm sure you've worked with that or heard that word. And there are some studies out there that show that, those things do play into a patient having or getting diabetes, basically. So, and the social determinants of health have to do with where you live, where you work, you play, your income, your education, the house you live in, the neighborhood you live in, is it safe enough, that type of thing. So all those little things that unfortunately us healthcare professionals have limited control over make a big difference. You want a patient to get a certain medication for diabetes, and they might not have health insurance, or their health insurance doesn't cover the medication that you think would really help them. We see a lot of financial and medication barriers, whether it's not being able to get the medication, or the patient not necessarily taking the medication, or trying not to use as much insulin because it's expensive. So there are, those barriers as far as medication goes. As far as, healthy eating and nutrition goes, part of it's a little bit of knowledge, because let's be honest, we don't get a lot of nutrition education in our life. But I find that most people kind of get they know they need to eat more fruits and vegetables, and they know they need to eat lean protein and try to eat more whole wheat products and not white products, and don't eat all the sugar you see. Like, most people know that, but it's do you have the money to get produce? Do you know how to cook vegetables so they taste good? Do you have a kitchen where you can cook them? Like things like that maybe we might not think of as providers or educators, but that person is living with. So that, the healthy eating. And then Or, my family doesn't like to eat this, but so there's a lot of different things with the healthy eating too.
Mhm.
Um, an activity, I would say, most people that don't exercise haven't exercised. So that's a big, and some patients have pain and they have joint issues, arthritis, because diabetes, there's inflammation. It's basically, that's what insulin resistance is it's an inflammation. So they deal with a lot of ailments that kind of stop them from exercising, but the movement could probably help with that. So there's a balance there too.
Yeah, absolutely. And, when you're talking to somebody, I always felt that there was a little bit of kind of a stigma when somebody said that they're on their track to diabetes. Whether it's pre-diabetes or, they're on their way to getting to type 2 diabetes. There was always a little bit of a stigma. Nobody wants to be told, hey, you're not eating healthy. Nobody wants to be told that, hey, you need to take better care of yourself. And navigating that conversation could get very hard. So, coming from you, with somebody who has that holistic body approach, how do you navigate that conversation of saying, hey, I know things don't look very good right now, but if you listen to me and you do what I am trying to tell you to do, then you're going to have a healthier and brighter future for yourself. How do you kind of navigate that conversation?
Yeah, I mean, first off, it's really important that you acknowledge the person as the person first and not somebody just diabetes. They're a person first, and you really want to get to know a little bit about what their situation is. So it's person-centered care in a way. And I really try to let the patient guide the conversation. I don't try to give my advice. I try to understand where they're coming from and what they're doing now. So someone that's eating, McDonald's and Burger King, and drinking soda, Mountain Dew or whatever it is all day and not drinking any water, I'm not going to tell them to, eat fruits and vegetables and whole grains and lean protein and drink water, because they're not there yet. So you kind of have to meet that patient where they're at. And maybe it's right now just focusing on decreasing how much Mountain Dew you're drinking and drink a little bit more water, or pick one meal where you're going to make it yourself at home. So really just starting with a small change and kind of letting that patient guide you, because they're the ones that live with themselves every day. And once you start asking the patient questions, they'll kind of reveal to you what they think that they could change.
Mhm. Yeah, and I mean, like I said, that the conversation can be difficult at times. Especially when you're hearing these things. I know myself as a provider, it's very hard for me to, or I shouldn't even really say as a provider, as an educator, when I'm talking to people, it's really difficult for me to kind of take that step back and be like, okay, like I know they don't know what they don't know what these choices and these effects have a compounding effect. And so for you, as maybe another provider is listening in on the podcast and they're saying, how do you deal with it? How do you say, that's okay, let's start from here? How do you kind of remove yourself, or I shouldn't even say remove yourself. How do you kind of distance yourself and deal with, hearing these things and then moving forward? So where would you start as step one? Step one is saying, hi, my name is Amy, getting to know the person. And then from step two, what is your kind of approach with this? Where do you find are the major areas where people can typically improve in?
Well, I mean, I feel like I'm a little biased because I'm a dietitian. So, and I feel like that is the area where I feel like I can get a lot of work done with somebody, as far as, getting to know what their usual eating plan is now. And then I do talk to them about, what are added sugars versus natural sugars, like that type. We go into a lot of detail with that, plastic food models, all those types of things. That's where I find that I can be the most helpful. But when I work with a patient, I really go through an assessment and see where they're at with their activity, what their labs look like, what medications that they're taking that are related to diabetes, are they taking them? Is there something that they could be, doing a little bit better with that? I try to get like a baseline thing. And if a patient isn't ready to, sometimes a patient comes to you and they're just not ready to make a change. And the patient has to be, if they're the ones that have to make the change. That just because they come and see me or a provider or somebody else in the office, if they're not ready to change, they're not going to change. So sometimes I have to be a little persuasive and say, if you do these things, your A1C will most likely improve, or you'll feel like you have more energy if you try to eat these, certain foods over these foods. I never try to look at food as good or bad. It's just what food will make you feel better, what food will fuel your body better, and have patients start to pay attention to how they feel after they eat, that type of thing too.
Yeah, definitely.
I don't know if I answered your question.
You know what? I actually was sitting there and you said A1C, and that immediately brought up the ABCs of diabetes.
Yeah.
And I was looking at the I'm reading through the ABCs of diabetes, and if I'm being honest, even when I was reading it, I was still like lost a little bit. I was still trying, like, they're going way further in depth than I ever could. So if you wouldn't mind kind of explaining what are the ABCs of diabetes?
Yeah, no, that's a great question. So ABCs is it's like a quick thing that can help patients maybe kind of try to stay on track a little bit more. So the A stands for A1C. So your A1C is a blood test that you would get done at a lab, or we do have point of care A1C at Hudson Headwaters now, which is great. So a patient could come in for a visit. We notice they haven't had an A1C in a while, and we can get it done right then and there instead of sending them to the lab. So that is something that's been very helpful. But an A1C is an average blood test over 3 months. So it's helpful, and that's what we use to diagnose diabetes. So diabetes in A1C would be 6.5 or higher. And in general, like the American Diabetes Association, for example, has their targets for diabetes to try to be, if someone has diabetes already, to try to be 7% or less. So that's kind of their target. And pre-diabetes would be 5.7 to 6.4. So that's that kind of range. So the A1C is a helpful tool to basically see where a patient's blood sugar is at. And then the B stands for blood pressure. So blood pressure is always taken at the office. They usually take a couple, maybe 3, depending on what the readings are. And depending on what kind of group you're looking at, American Heart Association or ADA, and depending on your cardiovascular risk factors, because there's a cardiovascular risk calculator as well. It's usually 140 over 90 or 130 over 80, depending on, what the person's targets are. And then the C stands for cholesterol. I think they might have changed it to like cardiovascular. I'm not 100% sure, but it stands for cholesterol. So the lipids, so your HDL, your LDL, and your triglycerides. And that is an important marker because a lot of times we find with type 2 diabetes, the triglycerides can be higher, the LDL can be higher, and the HDL can be lower. So we want those kind of flipped in a way.
Yeah, absolutely. As we're kind of talking about with you guys at Hudson Headwaters, you guys really do have one of the most robust support systems, education systems, one of the biggest clinical systems in our area right now. And, it's extremely important for us, not only at a county level, but also to the residents in the county. And you guys offer a lot of services and a lot of these support groups and a lot of different directions for people to go in. And if you wouldn't mind kind of speaking on Hudson Headwaters and their diabetes education program, because it is one of the most robust in the area. I've been reading on it for a while, but I'm sure you know way more than I do. So if you wouldn't mind going into the diabetes education program and really just kind of talking about what you guys are doing and what you can offer for the residents of the community.
Yeah, absolutely. I mean, I think in general at Hudson Headwaters, we take like an all hands on approach, or all hands on deck approach, I guess you could say. So pretty much everybody from providers to care managers, to our diabetes education team, to nursing. I mean, everybody has got their hands in diabetes. So as far as my team goes, we have myself, and then we have Emily Hammond, who's a diabetes educator that has been with Hudson Headwaters for many years, and she is very good with working with patients and one-on-one, and she's up in the North Country, so she's at a lot of the smaller health centers, which is great too, to kind of reach the rural population up there a little bit more. We also have another dietitian, Alex, and then we have diabetes nurses. So our diabetes nurse education program was started back in 2020. It's one of the things that I was working on when I was hired in my current role. So we have right now about 12 diabetes nurses that are LPNs and RNs that are embedded in our healthcare centers already. And they provide basic self-management education to our diabetes patients. So they're kind of like the gateway sometimes for patients, and then they can send referrals to other services, whether it's behavioral health, care management, nutrition, more advanced diabetes education to Emily. So they're kind of like our gatekeepers, I guess you could say. And they do a lot of good one-on-one diabetes teaching.
Yeah.
Yeah.
Well, for somebody who may have diabetes and they may be listening in on this podcast, obviously you work very closely with these people and you work very closely with the community. What are some words or tips or, some advice for somebody who may have diabetes listening in on this podcast? How can they better manage their diabetes?
Yeah, I mean, from a Hudson Headwaters standpoint, definitely making sure, you're keeping up with your doctor's appointments and your lab work, and, your yearly, your eye exam, your dental exams, your foot care, all those things that can help either prevent or manage your diabetes. And then as far as the day-to-day stuff, because let's be honest, diabetes is a bunch of self-care behaviors that you have to do over and over and over again. I mean, the minute you wake up in the morning, if you take insulin, you check your blood sugar, you give yourself insulin, there's a lot involved with it. So it's really just kind of staying up on, checking your blood sugars, getting in your 30 minutes of physical activity if you can, trying to get your sleep in, not being stressed, trying to eat healthy regular times during the day. So those are all like little things you can do at home that can make a big impact. However, it can also lead to, burnout, and diabetes distress is a thing too. So it can be challenging, but those are just some simple things that, you can try to do.
Now, you discussed the distress and the burnout that can come with this. Do you guys have any like support groups, or do you guys partner with anybody in particular about maybe somewhere for people who just had a diabetes diagnosis to go and talk about the, the struggles they're having with diabetes, or, really just kind of the weight on their shoulders that can come from something like that. Do you have a support group or anybody that these people can talk to?
That's a great question. And it's come up a couple times, like in talk with me and some of the diabetes nurses. And, right now we don't. And I think COVID kind of squashed that a little bit. And I know we could probably do something online, but we haven't started that yet. And I think down the road, we will definitely want to, because it has been brought up that, having a support group, not a lecture class, just someplace where, patients can kind of talk and voice their, concerns would be a good thing. We do have, there's the Heart Healthy Coalition. It's up in the North Country, and it's run by somebody named Ann Morgan. And she was trying to do a thing up in the North where it was like a referral thing, where it's this class for diabetes or anybody with chronic disease. And it's more of like it's not a support group per se, but it's a class. It's based on the Stanford curriculum that basically it could be peer led. And it's chronic disease self-management class. So she was trying to start some type of referral system up in the North Country for when people were doing classes. So I know that care managers were working with her to see if they could refer some of our patients to those virtual classes. And those classes are really good because it is like a script-led class, but it offers a lot of time for patients to share their thoughts or, chime in a discussion. And a lot of times it is a good discussion that comes out of it. And it makes people feel connected a little bit more, because I think we've lost that with COVID, the human connection as much. So COVID's kind of squashed the support group thing, but I do think it's important. And it's funny that you mentioned it because, I was just talking about that with somebody. So
Yeah. And, I think it's definitely obviously something to always keep in mind. I think anytime you receive any kind of diagnosis, it can always be a little bit hard. I know myself, I work in public health, but I hate the doctor. And every time I go into the doctor, it really does kind of stress me out. So having that support system is always really great. And, it's not even just having a support group or somebody else who's sharing the same situation with you, but it's also about being comfortable to tell your doctor what's going on. Tell your doctor what you're feeling. For me, that was always a big struggle when I went to the doctor. I was the kid who sat on the table and I let my mom talk. I let her tell him what was wrong. And that can definitely be a little bit disheartening if you're the provider. You want to hear it from the person themselves because they're going to be able to explain it better than anybody else. And for yourself, when you're talking to these patients, how do you establish that rapport with the patient? How do you establish, I'm here for you. You don't have to be scared about telling me anything. You just have to tell me the honest truth.
Yeah, I think being a good listener is very important, because if you've ever been in a conversation with someone that you're trying to talk to them, but you just feel like they're not listening, that's not going to help. So really, listening to the patient. And also, I personally like to give a little sense of humor into what I'm doing to just kind of make it a little bit more comfortable or get a little laugh out of them, in a good way, kind of break the ice type of thing. But I do think that that takes a little time too. I get to spend 60 minutes with a patient initially. So I get to have a little bit more time than maybe some of the, other providers. So in that 60 minutes, when I first meet somebody, I can see in the beginning where they might not be very forthcoming, but when we get towards like the middle of the session, if the patient's open to talking, we can get some good work done with them, being a little bit more honest. But it really comes down to, the energy that you give off as well as the provider, because people pick up on that too. that can make a difference.
Yeah, definitely. And, with Hudson Headwaters, like I said, you guys have been really one of the leading healthcare systems in Warren County right now. You guys really have gotten a very robust diabetes education program. You have your HIV and AIDS program. You guys really are kind of leading the forefront of community health for us. And we really appreciate you. We don't tell you guys enough, and I don't think we ever could tell you guys enough, but we really appreciate you guys for everything that you guys are doing, not only for us but also for the community members. You know, diabetes is a hard kind of topic to kind of navigate. We try to make it simpler with ABCs and things like that. So as a patient, what are some things that I can expect going into Hudson Headwaters and saying, they diagnosed me with diabetes. What kind of happens next as a patient in Hudson Headwaters? What kind of happens for them?
Yeah, I mean, once you get diagnosed, obviously you would meet with your primary care provider and kind of discuss like the next steps. A lot of times there's a referral for diabetes education, whether it's a diabetes nurse or a diabetes educator, and then there's usually a dietitian referral. Not all the time, but if the patient's open to it, there usually is a nutrition referral. Depending on, what the patient is dealing with and their own life, there could be a care management referral. So we've got care managers embedded into every health center. And that's where the social determinants of health come into play. They really can help patients, navigate the health system a little bit better. With appointments or, with needing services outside of the network in the community, more of those community resources. So they're a great referral to make. And then of course we have our behavioral health as well. So depending on where the patient's at, they could get any number of those referrals. And then we also have some providers that are trying to do some like diabetes only visits where it's like a 30-minute visit and they only talk about the diabetes part of it as well. So that's just a couple providers in the network are doing that now. So we'll kind of see where that goes in the future too. And it's just when they're newly diagnosed, they might have a little bit more appointments in the beginning, but it's really just meant to help them kind of stay on track because we don't want to lose them, waiting too long to get lab work and, making sure they're on enough diabetes medications to really help them in the beginning because there's evidence to show that can make a difference long term when there's more of that type of therapy initially. And then we also have our food pharmacy program, which was originally started in 2019 and kind of has taken different shapes, but currently right now, we are in quite a few health centers. So we're in the South and up in Plattsburgh as well. And that is a program that is really aimed at the food insecurity aspects. And a provider can make a referral for a patient that they think would be appropriate for the program. So most of the patients are pre-diabetes, diabetes, usually a BMI of 30 or more. So there's a little bit of an obesity factor. There are some, patients that don't fit that criteria. There's some exceptions here and there, but for the most part, it's a program focused on diabetes. And if they get into the program, which most patients do when they get the referral, it's a 6-month program and they get produce, fresh produce every other week in a produce box. They either pick it up at the health center or they have it delivered. And then we have new for like this past year we're using an app where we connect with the patients over the app and do some health coaching, that's where we give them recipes. We've got some videos on there. So we're trying to connect with patients, you know, more using more technology as well.
Absolutely. Wow. And I mean, you know, like I said, those programs, I mean, wow, I had no idea about the food pharmacy program until now. And that, man, I want to sign up.
Yeah, I mean,
You
it's
know,
we try to source it locally. So not only does it help the patients, but it also helps the local economy too. And we partnered with Comfort Food Community that's out in Greenwich, and they're the ones that basically source the food for us and deliver it to the health centers. So that's been a really great partnership as well. And patients say the produce definitely tastes better than the grocery store because it's fresher. So that's always nice to hear. And they try different things like celery root or rutabagas or, you know, daikon radish or, you know, ramps or whatever what was the other one we had? They're like, garlic scapes, like different things like that, you know.
yeah, I have no idea what those things are, but I don't think they have them in Hannaford, but we'll have to go and take a look. But, you know, like I said, your diabetes program is really one that we exceptionally really want to highlight. You guys have been exceptional all through the pandemic. You guys have been exceptional way before that. And you guys continue to strive to be your best selves every single day. And we absolutely love that. We 100% want to highlight the importance of not only, you know, things like your food pharmacy program or your Brian White program. We really want to highlight you guys yourself and the things that you guys are doing for the community. We really, really appreciate you guys for everything that we do. And, you know, as we're coming to an end here, do you have anything that you want to point out, anything that I didn't let you get to the point of, or anything that I missed that you would really like to highlight for the rest of our audience here?
I mean, I feel like with Hudson Headwaters, the sky's the limit as far as, you know, being innovative and open to, you know, that definitely the administration is open to different ideas and that type of thing. And, you know, we really try to take it, like I said, an all hands on approach with diabetes, whether it's, you know, the people that you see when you come into the health center, the nursing staff, the providers, the PSAs, or it's people behind the scenes that you might not see as much. You know, we have a population health or performance improvement team that does a lot with our quality measures, and they've done some different diabetes projects to help patients come into the health center to get their A1Cs done and stuff like that. So whether you're patient facing or not, I feel like everyone's got their hands in on diabetes, and everybody needs to, because it's definitely not going away. And for some reason, it seems like it's not getting any better, no matter what we do. But I do think the people that come in and are engaged in the health center and are willing to make some changes and work with us, they definitely see results. And you know, we hope that, you know, their lives can improve with that, because all it comes down to is your quality of your life and being able to live a healthy, happy life and not having to always be concerned about your health, you know?
Yeah, absolutely. So first off, thank you so much for taking time out of your day. I know you guys have been very, very busy as of recently with everything going on. So really appreciate you taking your time out of your day to come and talk to me about diabetes. You know, I'm going to try and say your name here again. We're going to try and get through the whole thing. So I want to thank Amy Wahl, the Diabetes and Nutrition Services Program Leader with Hudson Headwaters. And thank you so much for coming on and talking to me about diabetes. I'm your host, Drew Crawford. I'm a public health educator here at Warren County Public Health. Thank you for listening. Be safe, be healthy, and we will see you back here next time.